So this week I thought we'd talk about the pain patterns around trigger points. So trigger points being so important in our understanding of pain pattern. And the one that often comes in is the pins and needles down the arm, which is related to that sort of syndrome in the neck, thoracic outlet syndrome, where the clavicle and the ribs get compressed and that nerve pattern that comes out of the neck under the clavicle through under pec minor gets congested. So we do the series of tests to do that, and our massage techniques for working on scalings is important. But subclavius is often forgotten about. Small muscle, sits on the underneath of the clavicle, joins down onto the first rib, about the size of your index finger, quite small, and often is forgotten about. So the trigger point pain pattern for subclavius is pretty identical to the pain pattern for scalenes because it sits on that first and second rib. And the pain pattern, pins and needles in the arm, numbness, whatever. So working on subclavius, normal pec work that we would just normally do. What I try and do is come underneath the clavicle and work through this way. So that's the first move. Second move is when you come into here, and then you're doing this move, and you're driving up as you go, which works really nicely. And then the third move, if you can lift the clavicle off the first rib. So to do that, I come around the other side of the couch, lift down, have the client hold my shoulder, I hold his shoulder, I come under the clavicle, and then as I lift, I push back. So I'm doing this backwards and forwards, lifting of the clavicle off the rib, and at the same time, coming along from the sternum underneath, just trying to get my fingers there, perfect, on subclavius, and getting the client to pull backwards and forwards. Lovely. And it works really nicely and really good for working with that traditional pain pattern down the arm. Clients waking up with pins and needles on their arms. Brilliant. Thanks.